So we're looking at another aspect of congenital heart diseases, that's like complications. Complications you can have in what? Congenital heart diseases. So one of the complications is hemodynamic complications. So you're having issues with fluid, the way your fluid is moving in the body. Okay, hemodynamic complications in congenital heart diseases. So let's just discuss it on a bigger platform, on a general note. So hemodynamics in congenital heart disease just refers to what? How blood flow and pressure, they are altered because the flow is not normal again. Do you understand? So these changes can profoundly affect heart function, affects how blood is reaching the various organs in the body, and there's a whole lot of long-term complications. So how hemodynamic concepts matter in this is pressure overload. So mostly when there's obstructive lesions like stenosis, or a valve is like it's too stiff, or there's coarctation of the aorta, it leads to ventricular hypertrophy. The ventricles are not being able to pump blood that is in them out again. Okay, so there's volume overload. So volume overloads issues in shunt lesions like ventricular septal defects. So blood can be moving from one compartment to another compartment of the heart, making blood overload in that compartment of the heart. So it causes chamber dilation. So you see that the chamber that is affected is becoming bigger because it's doing much more work than the other one. You understand? Then cyanotic and acyanotic ones. Cyanotic ones, blood is moving from the right to the left. So you're having a mixture of deoxygenated blood and oxygenated blood. You understand? So it's reducing the oxygen concentration of the blood. Then acyanotic ones, that one is left to right. So that one, oxygenated blood is moving to the right. Now much blood has to be pumped to the lungs, and the lung is reoxygenating blood that it's oxygenated again before. You understand? The pulmonary hypertension is chronic left to right shunting, can lead to elevated pulmonary artery pressures, damaging lung vasculature. So may progress what? Eisenmenger syndrome, where shunt direction reverse due to high pulmonary resistance. So diagnostic tools for hemodynamic assessment: echocardiography, cardiac MRIs, cardiac catheterization. So they directly measure pressures and oxygen saturation across chambers and vessels. So this is how you can be able to note. There are clinical implications. So the changes guide treatment timing, whether to monitor, whether to start treatment, or whether to operate. Do you understand? So they usually use this as a concept, to know the next decision to make, and also know, to what extent the disease condition has actually affected that patient.